This is a relay project.
Real Talk starts right now. Here's Ryan Jesperson.
You know, this can be a really personal question when you ask somebody, what's your top healthcare issue? Because it's different for everyone. If you tuned into our most recent episode, that would have been on the 4th of December, you would have heard from somebody whose husband just chose medical assistance in dying. That was Glenn Grant, 27 months after he was diagnosed with ALS, and his wife, his widow, Willie, joining us on the show, talking about that journey. What a powerful conversation that was. As soon as Willie left the studio, who stepped in? Matt Masters, the popular singer-songwriter out of Calgary, had no idea that he may have had some mental health challenges. He knew he was dealing with some anger issues. He was pretty sure his cannabis habit was, well, a full-blown addiction, but it wasn't until he was diagnosed with bipolar disorder that he was able to start truly getting help. That's 2 examples of a million. But in your household, it might be somebody that's been waiting 18 months for a hip replacement. Maybe you're waiting 9 months for an MRI. Maybe you'd love to get referred to a surgeon, but you haven't been able to find a family doctor for 18 months. We're going to get to, we hope, your top healthcare issues today in back-to-back one-on-ones with the federal Minister of Health and Alberta's Minister of Health. That's coming up in 30 seconds. First, I want to let you know this episode of Real Talk is happening with the presenting sponsorship of Alberta's top online real estate school. That's Rello at rello.ca. More and more people are choosing careers in real estate because, quite frankly, they're sick and tired of those cubicle jobs, and they don't love having their income capped. But you know, there's a lot of competition in this industry, so you want to make sure you start off on the right foot. And Rello's team of expert instructors can get you there. They've got these gatherings, these online get-togethers on the weekends to make sure you're prepped for your exam. They're going to help you understand what goes into the licensing process. And then when you need advice, once you've actually launched, they're there for you too. It's a relationship with Rello, and they're all about value. You can learn more about what sets them apart by checking out their website. And don't forget, you can save a couple of $100 with the promo code Ryan100. That's all one word for the Alberta residential and commercial real estate bundles. The promo code Ryan100 when you get started today at rello.ca. As we welcome Canada's Minister of Health, the Honourable Mark Holland, out of the riding of Ajax, where he's been elected, 6 times? First under Prime Minister Paul Martin, then you saw the opposition benches under Prime Minister Stephen Harper. Here you are again now under Prime Minister Justin Trudeau, a key cog in his cabinet, and quite frankly, a government facing some real political challenges. What brings you to the province of Alberta?
Well, we got a great announcement today. So we're going to be making an announcement working with the government of Alberta to make some really important improvements to the healthcare system. This is the third time that I've been in the province to make a major announcement. So Adriana and I work well together. Glad to be back.
You're talking about Minister Adriana LaGrange. She'll be joining us right after we talk to you, and we'll get her take on things. How would you characterize the relationship between the federal government and the provincial government on the health front? Most people just see the headlines, they see the tweets, they figure that this relationship is characterized by animosity and opposition, but what's it really like behind the scenes?
Adriana and I get along really well. I think she's somebody who deeply cares about the country and her province, and we can have really good conversations about the change that needs to happen in our health system. And you know, this is the good news. I don't really think it matters whether or not you're on the left or you're right, or you come at it from a social justice angle, or you come at it from a cost angle. We have to transform our health system. We can't afford the status quo. It'll break us. 70% of chronic disease and illness is preventable. Most of the things that fill our hospitals and our emergency rooms don't need to be there. If we do the right things, not only can we create better health outcomes, but we can save just a boatload of money. So there really isn't a need for friction. We know in data, empirically, what we need to do in our health system. And I think everybody in the country, I don't care what your political stripe is, they want us to get it done.
I think some people wonder if progress can actually be made. There's a lot of provinces that are actually looking or demanding, let me say, more autonomy over their healthcare funding. Is Ottawa, are you willing to loosen the reins for provinces like Alberta that are making these demands, or is the federal government committed to maintaining conditions on healthcare spending?
Well, look, Europe, which literally went to war with itself many, many times, is able to figure out how to work together on health. And they're going to they're right now in the process of transforming their health data system. They have very different jurisdictions, but they're working together. If we're going to apply the miracles of AI and some of the technology that's coming, it's about cooperation. It is an imperative. So it's not a nice to have, it's a must have. And so I don't look at it as a matter of jurisdiction. I'm deeply respectful of provincial jurisdiction, but the question is, how do we work together? If I can go to the G7 and meet with health ministers and talk about antimicrobial resistance and pandemic preparedness, and we can understand as independent countries how we must work together on those issues and health data and others, then certainly we got to understand it in the confines of our own country. So, you know, the relationship that I have with Adriana is really based on cooperation, respect for jurisdiction, but how do we amplify, you know, what we know we need to do, which is to prevent illness and to make sure people don't get sick, make sure that we reduce the load on our health workforce, and that we bring the kind of changes to reduce administrative burden and make the life easier of the people working in the system so they have more time to take care of people.
Take a look at our Real Talk live chat powered by Park Power, your friendly local utilities provider. And we've got Les in there, says he's waited over 8 months for heart testing, says he's got a kink in his aorta. Matt says he hasn't had a family doctor in 5 years. Sharon says she's waiting to see a doctor at the Lois Hole Hospital, which isn't too far from right here. She says it's been a year. This is kind of the story across Canada. How does the federal government begin to tackle something like that?
Well, look, there are things that aren't working in our health system, and we got to be straight about that. There are things that deeply frustrate me. But there are also things that are absolutely amazing. You know, I just met a family at Ronald McDonald House where their child had a immunological condition that threatened their life. Everything was paid for. Everything was taken care of. You know, BC, I just was there not too long ago talking to somebody who's in pediatric cancer. When she started 30 years ago, the survival rate was 30%. It's now 90% for kids who walk through that door. And the people who walk in there, they're not devastated. They aren't financially. They walk out financially intact. That matters. So we need to build on what we have. And I make that point because we got to acknowledge what's not working, but we also have to acknowledge what is. And if you throw out what's working, then you're going to wind up with something that's worse across the board. Look, we've signed bilateral agreements with every province and territory. And what's big about that is for the first time, we have common indicators across our health system to show how we're improving every year. Can you imagine, like Ryan, we never had that before. Before it was all anecdote. For the first time, CIHI just released their baseline data, and it's good. It shows that almost every province and territory, and certainly here in Alberta it's true, we have more doctors, more nurses. We also have gone and done some really important things on prevention. Imagine dental care. Just over 6 months ago, we had hundreds and hundreds of thousands of seniors with desperate need for dental care who had never had any access to it. We've connected in 6 months 1 million people to care. It shows what's possible when we work collaboratively. And when you think of what that means for prevention, I was out in Gander talking to Dr. Redmond. Can you imagine that in the first 3 months of the program, they found 3 oral cancers in their one clinic? What would have happened to those people if they didn't cost?
Well,
How much money
dentists have
would it
been
cost?
saying this for 50 years.
So we got to do that across the
system.
system.
You got to do it across the system. A lot of Canadians have kind of criticized that national dental care program, saying that it's either overly bureaucratic or that it leaves out too many Canadians. It does leave out a lot. What do you say to those critics?
Well, there's no bureaucracy. We work with existing infrastructure. So it's one of the leanest federal programs in existence, and it is delivered in just 6 months. Extraordinary results. 3 million people have signed up. Over 1 million people have gotten care. But in terms of the people, it doesn't leave anybody out, because what we're doing is somebody who doesn't have doesn't have insurance is covered under this plan, and somebody who has insurance continues to use their existing plan. So it uses existing infrastructure. What we haven't done yet is for folks between 18 and 65. That's coming. Okay, so early next year, Ryan, we're going to be rolling it out to the existing cohorts.
That'll be an election promise.
No, it won't. That'll be something we do before an election. We are absolutely committed to making sure that by the time there's an election, every Canadian everywhere in the country has access to dental care. Think of how huge that is. Imagine what that's going to do in terms of prevention.
It'd be huge for you to be able to campaign on that, for sure.
Sure, but I mean, look, this will be my 8th federal election, right? And I think when you ride this thing enough times, you understand you never know how long you're there. I've won, I've lost. You know, what you're left with after you lose is what did you get done? And I'll tell you, the most powerful thing that I've ever experienced in my life is, you know, bumping into somebody. I was talking last night to a denturist Over 60 years, this lady had the same pair of dentures in her mouth. Can you imagine that? And that's not an uncommon experience. And talking to imagine how much emotion you have as a care provider. You put a new pair of teeth in somebody's mouth. They can bite without pain. They can smile with pride. They line up family photographs afterwards. Like, you go around, like, that stuff touches your heart in a way I can't begin to tell you. And it has such a powerful impact, not just on their dignity, not just on their health, but of their sense of self-worth and being seen in the world, of realizing, hey, I matter. You know, somebody cared about my smile, and now I can go out and I can be proud of my smile and proud of the way that I am in the world. Everybody deserves that.
I think that everybody would agree. Everybody knows about the power of a great smile. And it's obviously, you're traveling the country, you're talking to a lot of people, and you get this anecdotal evidence that the system's working. You see some of the numbers that indicate maybe things are trending in the right direction, but you've got a guy that figures he has a kink in his aorta and he's waiting months and months. And I have a friend that waited 9 months for cancer care. Ultimately, it was too late. I mean, this gets really personal for people. I mean, is this a federal problem? Is this a provincial problem? There's a lot of finger pointing when it comes to healthcare funding, access, deliverables. I mean, ultimately, how do you get it so somebody is able to get an MRI in 5 weeks, not 10 months?
Well, first of all, to everybody who's typing in and talking about their challenges in the health system, I just want to empathize with them and say that I fully understand where they're at. It's the most painful part of this job. You can imagine when I'm talking to Inuit leaders and they're talking about tuberculosis still being in this country, a disease of squalor that's entirely preventable, or I hear about all the different problems that are present. It weighs on your heart. But here's the thing, Ryan. The way that you fix things is through incremental progress and relentless incremental progress. It's a conveyor belt of progress. It's what we do as human beings. I remember Robin was in PEI as a nurse who said to me at the beginning of this journey a year and a half ago when I became health minister, look, I can handle anything, but I can't handle the idea that it's going to get worse. She's working and toiling inside of the system. And I think about Robin every day, about how do we prove every day things are getting better. Because once you see a line of progress and you know that we're moving towards fixing these problems, then there starts becoming consensus around it, and then we demand that progress to continue, and it becomes inevitable. We have one of the best health systems in the world, but we can have the best health system in the world. Imagine in Canada, we have an advantage. We're number 2 in the G7 in terms of the number of years that we live in good health. We're 1 year ahead of France. We're 1 year ahead of Italy, 2 years ahead of the United Kingdom, 6 years ahead of the United States. I want this to be the greatest country in the world in which to age and to be healthy, and we can do that together. That is a common problem. I don't point any fingers. I think we have to work together. And somebody asked me about healthcare. I don't talk about what the provinces aren't doing. I talk about what we are doing together and about our shared responsibility. And I think everybody should expect us to do that.
In our live chat powered by Park Power, Erica says, in a study of all countries with public health care, doesn't cite the study, but I'll do my Googling while you're talking. She says Canada was near the top in money spent on healthcare per capita, but ranked near the bottom in every conceivable metric on outcomes. Erica says it's truly pathetic. What would you say if she said that to you at a Mingler?
Well, I just said that on the G7 in terms of health span, that we're number two. We're one of the top in the world. That is a huge deal. So in other words, our public health system means that we spend more years in health than just about any other country out there. So while you're Googling, you can take a look at Canada's health span. And this was at the G7. Other countries are asking, how do we emulate Canada's success? So we can't throw out what is working because we have frustrations on what's not. If you're a kid and you get cancer, or you're an adult and you get a heart attack, when you're in a crisis state, our system responds like no other in the world. And it is there for families. And you talk to anybody who's in a crisis state, when their family needs that help, it's there for them in a way you can't believe. That same family I was talking about at Ronald McDonald House, the husband had a sister in the United States, talked about how their family was absolutely devastated financially. So, the reality is that we have things to improve, but we've got a lot to build upon. And the thing that I would agree with that comment, Ryan, is that we have enough money in our system. What we need is transformation. And if I could talk about that just for 1 second. We got Bill C-72. Now, this may not sound sexy, okay, talking about data. But if we have an integrated data system in this country, we can apply solutions like AI Scribe. That one solution for family doctors would save anywhere from 3 to 5% of administration for them. That represents about 1,000 new doctors, and we could do it in 6 months, right? There are things that we can do to transform our health system in huge ways by having interoperability and data and connection. And so that's why I'm so passionate. I'm not aware of any political party that's against this legislation. It's called Connected Care. Why aren't we passing this with unanimous consent? Provinces want to do it. This is going to save lives. This is going to open up new avenues of care. Also, to the point of the person who made that comment, we have to be deeper invested in prevention. That's why pharmacare is so important. That's why dental care is so important. We have to stop people from getting sick because it saves so much money. It's not just that we want people to be healthy. I mean, first and foremost, that's what I want. But secondly, I want our health system to save boatloads and boatloads and boatloads of money. When people don't get sick, we don't pay for all of their illness. It's a dumb way to do it. And anybody who's there criticizing the existing paradigm of the health system, I'm 100% with them. We have to change it.
Okay, so this is just on the fly. This is just me tracking down some numbers that I can find per the Conference Board of Canada. I'll cite some sources here. They rank it by provinces. Number one, they say BC places top in the country, scoring an A on its healthcare report card, third overall after Switzerland and Sweden. What about that? They have Canada ranked 10th behind countries like the Netherlands, Japan, France, Norway, Australia, Switzerland, number one there. I'll go back earlier to the Google search. You got to name the sources because I think that does factor in, right? The World Index of Healthcare Innovation has Canada 25th in the world, down from 23rd. In 2021, the Fraser Institute, you can almost hear some folks in the audience rolling their eyes, but still the Fraser Institute across 40 indicators ranks Canada 28th out of 30 countries, OECD countries, for the relative availability of doctors. International Citizens Insurance in their best of the world country rankings has Canada 4th, achieving an overall index score of just over 94 points. So there's some context for you. It depends who you look at. It depends who the source is. But this kind of stuff, Minister, doesn't matter if somebody can't get their hip replaced and they're worried that they're becoming addicted to opioids.
They want a system that works for them,
and that's what we got to deliver.
But I think, but this is where I think we get at the crux of it. You have to do two things. You have to have common indicators. This is what we put in these bilateral deals that we sign with every province and every territory, so you can see in data the progress we're making. Then, secondly, you got to show progress, and I say you got to show progress every single day. I should be held to account every day about what are we doing to improve the health system that day to show that we are moving constantly forward. And then the third thing is, if we're looking at things that aren't working in our health system, and we're looking at countries that are getting some things better, more right than we are, then we should be emulating those things and accelerating towards them. And I'll tell you, in every single one of those instances, it's a public system, it is publicly funded, it is publicly delivered, and it is focused on prevention and avoidance of illness. So we know exactly what we need to do. There shouldn't be any debate about it. Where the debate should be is how fast can we do it? How fast can we get there? How fast can we show progress? So for me, this agreement that we're signing today, last week we had a really important one on breast cancer screening with the Canadian Cancer Society and working with researchers on how we close the gaps on breast cancer. So, we had earlier, deals on personal support workers and make sure that they are properly paid. We have things on drugs for rare diseases. We have work that we're doing on diabetes medication. So I'm trying with anybody who's willing to work with us to push forward this health system and improvements in it everywhere, anywhere, all the time, so that people like Robin and people like the people you're talking with there on the chat can see that better things are coming for them. Because I don't have a teleportation machine, Ryan. I don't have a way for us just to get from where we are to that perfect health system. But we know that we have to do the hard work one step at a time of pushing until we get there.
You're talking about AI Scribe. I'm not 100% familiar with it, but I'm assuming it's some form of AI that's going to help physicians take some of the work off their desk.
Yeah.
There's obviously got to be checks and balances there. The wrong word or two entered into a chart, something missed, could obviously have huge implications. But how much do you think AI and machine learning, whatever it is, will factor into the future of healthcare? Maybe in particular in rural and remote communities, many First Nations communities that obviously have huge issues when it comes to access to care.
More powerfully than either one of us can even imagine. This is the equivalent of having a conversation, Ryan, before the internet and talking about how the internet might change our lives times 100. This is huge. And here's the thing, Europe is way ahead of us. Europe is integrating their data system and interoperability and making sure that their whole health network is connected. Because in order for AI to work, you need a couple of things. One, you need good governance to protect private data and make sure that people's private information is protected. Number two, you have to be able to have large data sets so that you can get all of that data in one place. Because AI only works when it can go through that data and look for patterns. I'll give you an example. We're coming close to the point where everybody, if they choose, can have their genome sequenced. What that's going to mean is you're going to have a personal health profile where you can put your environmental data, your personal history, your genetic history, and then actually have your genome. And then as things are found out, AI can scan that and say, oh, you went to a walk-in clinic for this, you went to your dentist for that, you were over at your physiotherapist for this, you have this genome, and that AI is going to be able to look at those patterns and say, you need to get screened for this. You need to take a look at that. You may have this. So this is going to be enormously powerful. Imagine with something like cancer, it's all about early detection. It's all about how fast can you get it and identify it so that you can attack it before it becomes something serious. So these kinds of tools are huge. To talk about AI Scribe just for a second, I'm picking on just one example because I think it's illustrative. If you talk to a doctor, what's their number one frustration? It's not how many patients they're seeing. It's the duplication. It's using a fax machine, duplicative forms, all of the administrative burden, and maybe that's 10% of their job, but it's 90% of their headache. And it's a lot of what's driving people out of the profession or not having them excited about their job. We have the tools to fix that. And it's not just that that's going to take that time and make them available to see more patients, and that's something that we can transform instantly. It's going to take all of that frustration off of their shoulders. They're going to be more excited about their job. Now, Ryan, I'm sure here at Real Talk you don't have this problem, but in most workplaces, there's stuff that's really annoying. It doesn't make any sense that you got to do that's bureaucratic, that exhausts you.
Nothing annoying here, Johnny. Would you agree? Nothing annoying.
Sunshine and lollipops.
Sunshine and lollipops.
Ways.
So you guys have figured it out. So we got to take that same thing of eliminating barriers and creating a workplace where illogical things are not things you're forced to do, because that makes your work more joyful. Doctors are willing to work insane hours for their patients. They care about their patients so much. But like other people, they hate illogical things that don't make sense. So an interconnected data system, it gets us there and it can help make that transformation fast. And here's the problem. If we don't do it, and Europe does, those statistics that you're saying, the countries that have an advantage on us are going to crush us. Like, it's no option. We have to do it.
Provinces like Alberta, our home province, obviously in Quebec, flirting with private healthcare. In your mind, does this threaten the sanctity of the Canada Health Act? What's your government doing to protect equitable access to healthcare across the country, including in those provinces?
Well, what we've seen for countries that have two tiers is when you have private care, what ends up happening is the money and the people who have money go and get that private care, and so then all of the pressure of the best surgeons, the best doctors, they're highly pressured and incentivized to leave a public system and go and serve private patients. And that means that the public patients, the folks who don't have huge bank accounts, are left with inferior care and longer waiting lists. And they've shown in every system that it's been tried, it leads to higher costs and worse health outcomes. So it is just a bad model to go. Now, I recognize that because our health system, and by the way, every health system across the world was having huge problems before COVID and massive problems coming out of it, because we're in a process of huge transformation. All of these tools, all this technological change, all of this information, it has to metabolize it. The workforce issues are competitive around the globe. But now, we're in a situation where if we work collaboratively, we can work through those things and get ahead of them. And that's where I think we need to go. I think Alberta is under a lot of stress, and I understand sometimes you can look at temporary solutions, but we really need to broadcast together that the future of our healthcare system is public and universal and cannot be changed.
You're going to be seeking re-election whenever the next federal election is, probably less than a year from now. Well, I can safely say that. Your boss, the Prime Minister, says he will as well. He said it on this show back in February, but there are increasing calls for him to step down. With his polling down, with the parties polling down, with pollsters predicting a sweeping Conservative win, does your government still have the political capital, do you think, to tackle healthcare reforms? How are you approaching it?
Well, I think, so let me take the second part of that first, and then I'll come to the first part. The second part of that is politics is one thing, it's consensus, right? So when we're talking about what we need to do in health, this is just basic, this is basic science, data, and evidence. And here's the thing. If we don't do it, we are in massive trouble as a country. So it doesn't much matter if you're a conservative and a Democrat or a liberal. This is stuff we absolutely have to do. And anybody who knows their stuff on health knows that what I'm saying is true. So, forget about the politics for a minute. If you care about this country, we have to transform our health system. And everybody has to be held to that standard. And hopefully we have elections asking the question, who's best able to make that transformation? Who has the clearest understanding of the change that must happen? Talk to health professionals, talk to people within the health system. Ask them who is getting it, who's getting it done, who understands it, who's moving the needle. Because we can't afford as a country. Because I'll tell you, we have one of two scenarios, Ryan, that are going to happen in this country with respect to healthcare. Either we're going to be in a situation where we don't get it done, where we continue the status quo, where we have an aging population and a tsunami of illness and disease that overwhelms our system and makes us more and more ill and cost our health system so much money we have to give up on universal care, or we make deep transformation. And with deep transformation, we prevent illness, we expand health span, we increase lifespan, we make sure that we have a health system that isn't overburdened with illness. Can you imagine what that would do to productivity? Can you imagine what that does to Canada's competitive advantage economically? It just makes so much sense. So I try to build consensus around that. And you notice I didn't really come to the politics because I think, that's what it's about. If you can build consensus that you can make that kind of transformation, and we absolutely are, then I think the political argument makes itself.
That's Federal Health Minister Mark Holland ahead of a meeting with our next guest. She's coming up in 60 seconds, Alberta's Minister of Health, Adriana LaGrange. Thanks for doing this. We appreciate it.
Thanks so much, Ryan.
Yeah, you got it. Let us know, Real Talkers, what you make of this. You can send us an email anytime, talk@ryanjesperson.com, or if you're like the hundreds and hundreds and hundreds that are watching this live, you can go ahead and hop into our Real Talk live chat powered by Park Power. This episode is happening with the support of our friends at Friesen Brothers, and they have you covered this holiday season. They have a situation ready to go where you can grab all of the credit and all of the praise for that Christmas meal, but you don't have to do any of the work. Let me tell you about their Christmas dinner box. This is what our family's been doing for years and years now. Their Red Seal chefs prepare this fabulous dinner. It's ready to be reheated in the oven so you can spend more time with your guests. You can order online at friesen.com. You can order through their app, or of course you can pop into any one of their 17 locations. Friesen Brothers is proudly Alberta grown and Alberta owned. One of our partnerships that we're most proud of, launched it just a couple of months ago, is one with Edmonton-based UCAN Youth Services. They're doing absolutely incredible work as a nonprofit based out of Alberta's capital, dedicated to helping young people 18 to 25 out of harm's way and onto a path of economic independence. You can check out some of the work they're doing. They're incredible storytellers. On their website, ucan.ca, they do a great job explaining more about their programs, the Road to Work program, the Verto project, and why their approach to helping young adults get onto a path of economic independence is absolutely relentless. Again, that's UCAN Youth Services, online at ucan.ca. At California Closets, they're ready to help you out with the gift for the person that has everything. Why not put a design consultation and maybe some budget to work with under the tree? Custom closets and storage solutions is what California Closets does better than anybody else, and that includes the garage. That's right. Maybe it's the person in your family that gets most frustrated trying to find the garden hose or the spare tires or their shin pads, but the garage is an absolute mess. Why not look to a premium garage organization with California Closets? That free consultation starts at californiaclosets.ca. And for those of you that would love to start 2025 off with a new opportunity, how about a new job? If you're an electrician, you got your ticket, maybe you're an apprentice, you've worked in sales for years and years, Kubi Renewable Energy would love to talk to you. You can check out the careers link on their website, kubienergy.ca. They're hiring through the winter months, so you'll be able to hit the ground running, all trained up, ready to go in the spring. They're based out of Lethbridge, Calgary, Edmonton, and of course Kamloops, BC, doing home solar power systems across the Western Canadian provinces and territories. You can check out their beautiful work online. Nobody installs cleaner than Kubi Renewable Energy.
And don't forget about RyanJesperson.com if you're looking for Christmas presents for your significant other,
Johnny.
your family, and friends. Head over to the website. We're already seeing a big influx of people buying stuff for Christmas.
You flagged that for me yesterday.
Some of those items are getting low, so if you want a snapback, if you want a Real Talk mug, very popular right now, get it before they're gone, before the holidays, RyanJesperson.com.
Johnny, we're going to give you a commission on all sales over the next 72 hours.
Thank
yeah, that's
you.
right. Check out the merch link. Well, we got an email yesterday. He pointed out to me. I didn't realize we have only 5 coffee mugs left, which is
5 mugs left.
Hasn't
Go
been that
now.
low for a while. So I think we've been giving away too many coffee mugs to guests, and all of a sudden now we're tapped. We're running low, but you can get yours just in time for Christmas. You know what we'll promise Real Talkers is we'll send those out by way of courier. I don't think we can trust Canada Post right now to get those ready for Christmas.
Hey,
so.
good.
Yeah, merch link at ryanjesperson.com. The Honorable Adriana LaGrange is Alberta's Minister of Health, and we're grateful that she's carved out some time to talk to us today ahead of her meeting with the federal health minister. Minister, it's good to see you. The federal counterpart, Minister Holland, says that his relationship with you is actually quite positive. He says that you guys can accomplish great things together. That's not the impression a lot of people get by watching the news. What's the truth?
The truth is, we do have a great relationship. We do really work well together. We have common goals. We want to see every Albertan, every Canadian get the absolute best healthcare possible. And so I sense that, and I see that in his willingness to look at our realities and help us do what we need to do in our province. Now, do we agree on everything? Not necessarily. And there are times we agree to disagree, but that's okay. We can do it respectfully, but we are working together. Today, we're going to have a great announcement on rare disease drug agreement. And we've had the shared priorities agreement. We've had the aging with dignity agreement. I'm looking forward to further discussions on the pharmacare. And of course, there's more discussions that have to be had on the dental as well.
Yeah, you kind of get the impression that Alberta and other provinces haven't been super keen on the proposed pharmacare plan. What's the official position as of December 2024 when we're talking?
Well, we already cover, a vast majority of drugs in the province. We have over 5,000. It's one of the most comprehensive in Canada. We don't like to see duplication of administration. We do want to see the programs that we do have enhanced so that we can provide more services to Albertans. I go back to, when Canada Health Act was first enacted, the cost share on healthcare in the province was about a 50-50 split. Right now, we spend approximately about $27 billion for healthcare in Alberta, of which we get about approximately just over $6 billion from the government of Canada, which again, we're all, there's only one taxpayer, so it's all of our dollars. But I see the proportion that's come back to the province has diminished. I'm glad that we are signing these agreements because that brings a little bit more of those dollars back to the province. But again, we have to look at this. Healthcare is a serious challenge. We look in Alberta right now, we have 1 in 7 Albertans are 65 years of age and older. That will be 1 in 5 very, very shortly within the next 10 years or 20 years at the most. So we have to tackle some of the serious issues that we have. It's why we're doing the refocusing. We need to address issues. Some of the good things that we're seeing is that cancer used to be a death sentence, and now people are looking at it as more of a chronic illness, and people are living longer. But that also brings challenges because then people need to have constant checkups, et cetera, and we have a limited workforce. So lots of challenges, lots of opportunities as well, and we have to be able to work with the federal government to address those.
Minister, the minute that I put it out to this audience, the minute that our live chat opened up and we started asking, informally polling audience members, what's your top healthcare issue? We saw an influx of comments and all across the map, waiting for surgeries. People are waiting for cancer care. People are waiting for referrals to specialists. Some people can't get family doctors. Now, I understand that, big wheels turn slowly. I understand we're talking about multi-billion-dollar budgets, obviously, but what is your government doing in the short term to alleviate these real crunches that for a lot of folks could be matters of life and death?
Well, and people forget that we as politicians are also Albertans with families. I watched my father die of cancer when I was 15 years of age. I had a younger sister died of the exact same colon cancer at the age of 29. I myself have had eye cancer, so I know the journey. that people go through, and I empathize with them, and I wholeheartedly feel we need to tackle these issues because we do have some very long wait times. We have started to address more surgeries. We're seeing more cancer surgeries done within clinically approved times. Alberta Health Services has actually done more, let's say 9% more cancer surgeries this year alone as compared to last year. We've overall done more surgeries. I know there was a backlog through COVID. There was a delay in people getting assessed and diagnosed, and then further into the treatment stage of things. We've gone from about 290,000 surgeries 2 years ago. This year, we're on track to do over 310,000 surgeries. Those are much needed hip surgeries. We're looking at hip and knee and cataract and eye, et cetera, et cetera. So we're looking at all of that. We're taking a multi-pronged approach. We need more doctors. We need more nurses. We've been able to attract more. I'm really happy to say that when I took office in June of 2023, we had roughly about 10,600 physicians in the province. We're now sitting at well over 12,100 physicians registered to practice, of which there are approximately 300 more family physicians. We've added the nurse practitioner program where they can practice independently. And we have 33 current nurse practitioners with an independent practice that have started practicing. We have another 23 that are going to be starting shortly. So that's about another 60,000 Albertans that will have access to primary care. We have upped the bursary program and actually instituted a new bursary program for medical resident students. We are creating post-secondary spots in rural communities so that we have an additional 100 doctors who will be graduating and able to work in our rural remote communities because that's where we really see a gap. So there's a multi-pronged approach. But for those that are waiting on the wait list, I can absolutely say, I feel your pain. I know what it's like to be there. And we're doing everything possible to reduce that. We've got the Alberta Surgical Initiative. We've added an additional $300 million to make sure that we can expand surgeries in other communities. So some of our rural facilities, our rural hospitals, we've now got ORs that are up and operating, and we've got more surgeries able to be done that through those areas. We've got the chartered surgical facilities. 5-6 years ago, we had about 40,000 surgeries that are publicly funded, provided in chartered surgical facilities that were being done. We're now over 60,000 surgeries being done in chartered surgical facilities. And those are, knees, hips, shoulders, those type of things, endoscopies. Screening programs. We upped our screening program. We've got the man van for prostate. We've got the breast cancer screening, but now we've added a new van for lung cancer. Lung cancer is actually the #1 cancer, and it outpaces some of the other cancers that are out there. So we're trying to do a lot of different things, but more needs to be done.
Yeah, I've been talking to a orthopedic surgeon in particular who's pretty concerned about these chartered surgical facilities, private surgical facilities, publicly funded, as you point out. But it's the same conversation you have with people around private education. Obviously, you're very familiar with the education file as well. They're concerned that investment in the so-called private facilities are pulling funds, pulling resources, pulling quality out of the public system. What do you say to Albertans that that's a top concern for them, including some of these physicians?
Well, I disagree with that. I respectfully disagree with that because when you look at chartered surgical facilities, as I said, those are publicly funded surgeries that are able to be completed in addition to what we have in our hospitals. Sometimes we're constrained in our hospitals by the hours that the hospital functions because of crisis management that they have to do, et cetera. When we look at chartered surgical facilities, I liken them to doctor's offices. Our family physicians, our rural generalists, they are independent providers, like they own their own businesses. So technically they are private companies that we contract to make sure that they provide healthcare to Albertans. So when you go to your doctor's office, you don't pay for anything because of the fact that it is a publicly funded system. It's just delivered by your family physician who happens to own his own clinic. So when you look at a chartered surgical facility, very much in the same vein, they are owned by the physicians or the companies that they're part of, but they provide publicly funded surgeries.
Minister,
So
I don't want to run out of time with you. You got a heart out. I don't want to step on your toes, but I got one more minute
no
with you.
worries.
So I want to ask you about worker morale. I mean, Dr. Paul Parks is probably a big example representing Alberta's doctors, wanting to know why it's taken so long to get the new pay structure implemented. Your government announced that back in April. We hear from a lot of workers, nurses, and the like, front lines reporting low morale and dissatisfaction with provincial leadership. What steps are you taking to rebuild trust with healthcare professionals, and what tangible actions back up those promises?
Well, I'm working very closely with the Alberta Medical Association. In fact, Dr. Duggan, who's the new president, she took over after Dr. Parks' time ran out here in September, that I actually have a meeting with her within the next half hour here. And we are building our relationship because we have common goals. We want to see our physicians get the due that they deserve, that we solve real problems by working together. You probably already know, Ryan, that in 2022, in October of 2022, we as a province signed an agreement with physicians across the province, a negotiated agreement. But when I came into office, I became aware that we did have issues with family physicians and rural generalists, that the contract that is in place, the funding framework that's in place needed to be adjusted. We needed to look at something different. So we signed a memorandum of agreement to look at that. We've gone through the process. There's a few more things to get done. I know we're very, very close. The Premier and I have made commitments to have this up and running for April of, which is the next fiscal year, April of 2025. So we're very close on that one. And we'll continue to work with our family physicians, rural generalists, and all physicians and surgeons, et cetera, across this province to make sure that we enhance the programs that we have. When I look at, the morale, we are in contract negotiations with every healthcare union in the province. We felt very strongly that we had a very good deal in front of our nurses that really would make them the highest paid in the country. And I do understand that they're feeling stressed, and we see that right across Canada and globally with healthcare professionals post-pandemic. We're looking to see, working with the associations and with the colleges, how do we help in that area? So Alberta Health Services, I know, has some strategies in place, but at the end of the day, we have to get past the negotiated agreements and then move into how do we improve the working environment. Part of improving the working environment that was also captured in what we had offered in the through negotiations was being able to hire 1,000 nurses as they come out of post-secondary, because we know we need more nurses and doctors, et cetera, on the front lines. As we've got a growing population, we've had over 400,000 people come to Alberta. That's wonderful. They see Alberta as the land of opportunity, but it does put a strain on our education system, on our healthcare, also on our social services system as well. So we've got some challenges, but we're up to making sure we meet those challenges.
Minister, I want to thank you for your availability on short notice. Thanks for doing I know you got to go meet with your federal counterpart. He's on his way to see you right now, so we got to let you go. Thanks for doing this.
Thanks so much. Merry Christmas to everyone.
And to you as well. That's the Honorable Adriana LaGrange. That's Alberta's Minister of Health. If you're watching on YouTube, you can already see Johnny's already got the live chat up, powered by Park Power. You talk healthcare, and obviously this is something that impacts just about everybody. And so we've got strong takes on this. Some of you, feel like, Alberta Girl says the pandemic demoralized healthcare workers. I think that's a safe statement, and says, and now, you can't even convince young people to do those jobs anymore. That's one of the things I think about Alberta Girl. I don't know about you, Johnny, either, but I think of, like, if you try to take yourself back to that age of, like, when you start thinking about what you want to do. For some people, I think it's like 6 years old, you want to play in the NHL, or you want to be an astronaut, or you want to be a fashion designer. And then sometimes it happens later in life. In high school, you find something that resonates with you, and you think, maybe I could be like a nurse, or maybe I could be a surgeon. But if you're paying attention to what's around you, and And if you're seeing like the demonstrations, and if you've seen labor negotiations that are getting contentious, and maybe that's its own ball of wax, that's its own thing, but maybe you're hearing from family members who either are working in healthcare or having a tough time navigating the healthcare system, and you go, I don't know, maybe there's an easier route I could choose. Maybe there's something I could do to make the same amount of money. Not about money for everybody, but for people it is a consideration.
I mean, most people.
When you're considering or choosing your career, that's something that factors in, and you're going, gosh, there are a lot of less stressful, less contentious, less demanding fields to work in. But boy, do we ever need the best of the best working in healthcare. And I think Alberta Girl's absolutely right. Some of the damage happened during the pandemic. I saw somebody here, I can't remember who it is in the live chat because it's humming this morning. Somebody basically said I think you're talking about either Minister LaGrange or the Premier Smith, she started this fight with doctors and then whatever. I mean, I'm not going to say that they've done everything that they can probably to assuage those concerns or to stop the fighting, but they certainly weren't the ones that started it. It's been a mess for a while. I mean, I can remember Health Minister Chandra under Jason Kenney talking about tearing up the agreement with physicians. I mean, that was like a declaration of war when it happened. And I don't think that there's been any improvement in the relationship since. I might be wrong. You can send us the brown envelopes with information to convince us otherwise anytime. You know where to find us. But, Lauren in here says, my doctors talk to me. They're not happy with the way that Alberta's doing things.
So you've got everyone unhappy, right? You've got, oversight unhappy. You've got doctors and nurses unhappy. You've got horror stories. I want to go to our TikTok because it's not currently on our Park Power live chat, but it will be.
We still see you, TikTokers.
We still see you, TikTokers. Boundless Boreal says, my kid can't walk. He's in daily pain. We waited a month for imaging. Now we're waiting 3 months for an MRI. Unacceptable. I hear these stories every day, not just on our show. Regular people every day who say, hey, I've got a pain in my stomach. I don't know if it's cancer or if I just have GI or an issue because I can't get an MRI. And I mean, we've talked about this on the show before. Is it easier to provide some private outlets? But then, those people that only, like you were just talking about, make enough money and can afford it can do that stuff. So it's kind of unfair, but it's just a scary time right now. And I mean, I could read all the comments from TikTok and from YouTube right now, but I saw at least 20 to 30 that were like, I still can't find a family doctor.
That's a constant and regular refrain from people. I still love knowing that people are watching us every morning on TikTok and Instagram and LinkedIn. How cool is that? Whitrium in the chat says no nurse or doctor in this province should be a private contractor. They should all be employees of Alberta Health Services. Stop with the waste in duplication costs. No more private practice and public pay. That from Whitrim. I mean, I won't get into the weeds, but as you know, like all family doctors, or at least the vast majority of them in the province of Alberta, and for that matter across the country, are entrepreneurs. They're running their own small businesses, and
I think people forget that. Like they're paying for the Xerox
very
paper.
Relevant.
They're paying for the pens and pencils. They're paying for the mat that you wipe your feet on. They're paying for all of that, right?
Yeah.
They don't just come into a setup, right? So they're small and medium and large size business owners, and I feel for them as well because I mean, I just heard on the radio today, rate of inflation in Alberta is one of the highest in Canada, even though we're paying less tax. So, I mean, all these economic thresholds and squeezes and tightenings, the doctors and nurses are feeling them too, and they're just trying to provide care at a level that is acceptable, and it's hard for everyone right now.
Doobie is watching us live on YouTube, says my doctor's email telling us she was moving out of province, specifically and directly blamed the combative policies of the UCP, of the Alberta government, which is kind of interesting. I received one of those letters. I told you about that a while ago during COVID. My physician announced that he was leaving his practice. It was a shock to me. I actually felt like I had hit the jackpot when I got in with his practice because he was younger than I was. When we started, when I started seeing this doctor, he was in his late 30s and just a remarkable guy. I don't even know what he's doing now, but he didn't get political in his letter, but it was pretty obvious that he'd had enough and he was fed up. And I know that that's been the story. For some of you, you'll see these numbers, and Alberta released numbers that the province added 500 family doctors in the past year. And I guess if you're a politician or if you're working on that file and you can find the statistics that support that narrative, you're going to put it out there. You're going to say, listen, there's a family doctor shortage and we're adding doctors. So look at the great job we're doing. But then you talk to people like real live people in the Real Talk live chat, and they're going, yeah, I haven't been able to find a family doctor for like a year and a half. You and I navigated those waters together, John, trying to find family doctors over the past year, obviously, off camera.
Hard.
We should have turned that into a bit. We should have done like a vignette on it.
I mean, finding one alone, but then also like you want to have a doctor, especially in the winter months, that maybe is, less than 25 minutes from your house. It's pretty much impossible. Like if you want a doctor, it's probably going to be on the opposite side of town. So going to the doctor is now a higher cost. It's more gas. It's more of your time. It's all these things,
Not
right?
to mention if you live somewhere, 90 minutes away,
Exactly.
or whatever the case may be. Ellen has a comment. She's watching live on YouTube this morning, and I'm going to take Ellen's comment, and I'm going to swerve way over here, and then I'm going to bring it back. Ellen says, I just had to pay for an MRI because I had already been waiting 6 months, and I had 5 more months to wait. So Ellen was given 11-month wait time for an MRI. She says, I can't walk. Geez, Ellen. She says, and I needed to know why. So she paid out of pocket for it. She says the UCP is directly responsible for this mess. That's Ellen's take on it. Now, here's where I'll swerve out is people will say, well, at least Ellen had the option. This is where people get really upset. People don't like talking about this. I know that for a fact. But Ellen had the option to go pay for an MRI, and then the UCP will say, well, listen, you have the availability of that. Alberta has a province where you have choices, and you can go and you can pay for an MRI and you can get it done. And other people will say, well, what about those of us that can't afford? And Ellen, I'm sure Ellen doesn't have $45 million in her checking account, but what about the people that say that's not even an option? I don't have a visa that I can put it on. I don't have something. There's no wiggle room there. And they don't like seeing people jump the queue, so to speak. And so the government in this province trying to navigate that. And in every other province, they're doing it in their own way. Alberta kind of takes this land of the free type approach, land of opportunity, the chartered surgical facilities, the private facilities. You remember that physician's clinic, that health clinic that opened up in Calgary, had kind of a membership fee. They're not the only ones, but these are the ones that you can go in, you see a doctor right away, you get an MRI right away, you can talk to a nutritionist and a dietitian. I mean, as a matter of fact, what they're offering at those private clinics is ideally, in a perfect world, what we'd like to see everybody offered if you want to talk about actual holistic health care. So what's the right answer? I mean, the UCP's answer on one front, it can't be exclusively, you just heard it from the health minister, is that we're opening up these surgical facilities. They're public funds. People aren't paying out of pocket to get those surgeries done, but they're not necessarily falling under the traditional structure that you might see in every other province. Some people inherently have a problem with that, right? I asked the federal minister about, whether or not he thinks that the Canada Health Act is being undermined by this type of thing. Other people, people that are maybe more experts in efficiency, people that might come into any business, be it healthcare or AI or auto manufacturing or anything else, and they'd walk in and they'd say, where's the backlog? Where's the bottleneck? And what's the quickest way to get as many people possible flowing through these centers? Well, that might be the type of thing they would explore, but healthcare is different than anything else. Healthcare and education, maybe. But these are the files where when you're talking about people's real lives, it's different. It's different than policy on things like capital gains and how they're taxed. Now, I know someone's going to write in and say, you don't think that my family's nest egg is as relevant, but it's not the same. If somebody dies because they couldn't get in to see an oncologist, or if somebody like Ellen can't walk and she has to wait 11 months to get an MRI, I mean, this is real everyday pain that is interfering with quality of life every single waking moment. And so no wonder people get all fired up about it. Speaking of fired up, we have a great submission for the Flamethrower that's coming up.
I was just going to say,
my
because
gosh.
so many people now, we have so many new people in so many different chats, TikTok, Instagram, Facebook, LinkedIn. If you ever want to say what you're saying in those chats and not just hear them read, if you want to go into length, if you want to go into detail, talk at ryanjesperson.com, because the end of the show every Friday. The Flamethrower brought to you by the DQs of
Northwest Edmonton and Sherwood Park. You were doing amazing.
Yeah.
I will say,
but you
today
know what I
it's
mean?
on a
If you want to,
Thursday,
if you want to do a lengthy rant, that's the place to do it.
100%.
Talk at ryanjesperson.com.
This from Lauren, and I think Lauren there's a lot of wisdom to this comment in the live chat, powered by Park Power, your friendly local utilities provider. Lauren says, I have a friend who's in the system working as a pharmacist, and he sees things quite clearly that we have no choice but to try something different. And I appreciate that comment very much. Now, I think sometimes change for the sake of change or something different for the sake of something different isn't always the best approach. It isn't always the best plan. This is how we vote. You know that. I mean, part of the reason, not all of the reason, not even close to all of the reason, but part of the reason why the Prime Minister is experiencing these polling woes, which you might call them, his plummeting popularity, is because people are sick and tired of the same old thing. It's tough to be a political leader for more than 10 years. Now, obviously, policy factors in. He hasn't delivered on a lot of fronts where people feel like he promised he would. There's more to it than that, but sometimes people just want change. We're watching the same thing happen in France right now. We won't get into it, but President Macron, maybe on his last legs with the shakeups happening over in France. You see examples all over the world, but I think there's wisdom in the comment that if you keep seeing the same shortcomings, if you keep seeing problems with access to care, timely delivery, wait times, etc., then you can't keep doing the same thing and expecting that it's going to get any better.
No, there has to be drastic change. So that's why, hey, I'm glad the federal minister is here and that the Honorable LaGrange as well said they have a working relationship, and it seems like they're going to talk some things out, because that's what we need. Even, it's bipartisan. This is like people's health. I saw another comment here on YouTube. When I have a chest infection for a cold, they said, one of the chatters, and I go to make a doctor's appointment and it's 3 months from now, that doesn't help me.
No, it doesn't help you at all. Doesn't help you at all. I get it. Super chat, Ken in the chat. By the way, speaking of the super chat, wanted to give a shout. I missed it the other day, and we always want to give these folks a shout out to Ms. B and Travis, who both kicked in $5 the other day to the super chat. Boy, do we ever appreciate you. That helps us keep improving the show, keep improving our offerings. This one from Super Chat Ken, who says, as long as government does the required regulation and inspection on private facilities, I don't have a problem with private facilities doing public procedures. But if money buys access, then that's a problem. That from Super Chat Ken. You can let us know what you think. I see some random comments in here as well. I guess it just comes with the territory. Kathy says the definition of insanity, doing the same thing over and over again, expecting different results. Something had to change, but what that looks like is definitely different for all. I didn't want to get in the weeds. I had like 12 minutes with the provincial minister, and but obviously, as we talked about with Dave Berta, if you missed that episode, I encourage you to check it out. That was our December 3rd episode with my favorite political blogger in the province of Alberta.
Dave Berta.
Dave, 20 years he's been doing this, and he's just released the results of his annual survey, the best of Alberta politics for 2024. And we talked to Dave, not just about obviously the award winners, the best MLA, the best cabinet minister, the best opposition member, yada, 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 but also some of the top stories that are happening right now. And of course, this health system overhaul, not in a position right now, I don't think, to talk details. Quite frankly, it would be boring on a talk show with the health minister. But once this is all said and done, you get a sense of how this is all being restructured. It's a huge deal. And Dave struck me as not entirely convinced that what the Alberta government is doing is going to be effective, but time will tell on that. You can always send us your thoughts, as Johnny mentioned, to our email inbox, or if you're joining us live, weekdays at 8:30 Mountain, 10:30 Eastern, we encourage you to jump in that live chat. Before we go any further, and I want to get to some of the comments on Joe Biden pardoning his son Hunter, because we got a ton of them. After touching on that was kind of a late Sunday evening, post-Thanksgiving, during the football games, kind of a move by the American president.
You're painting a picture. I can see them sitting around the fireplace being like, Dad, come on, Dad.
Dad, when are you going to part?
Daddy!
Trump's going to throw me in jail, and he probably was.
Oh, can I say also, thank you for not bringing up this week. I know it was trending, and we usually talk about it, but thank you for not bringing up the 51st state in the U.S.
Oh, I mean,
I was glad we just didn't talk about it, but people have been every day in the chat. Are you going to talk about it? Are we going to talk about an AI photo that was horrible, posted by someone who clearly had no idea what they're doing?
It was Donald Trump basically saying, "Oh, Canada," and
alluding to the fact that they could come up here, take us over, make us the 51st state.
You know why?
There were some comments.
Because he talked to Joe Rogan about our water. That's course. Why.
But the problem with the photo is he posted a picture of him standing in front of a wind-driven Canadian flag, looking over a beautiful plain of snow and mountains. The problem is the mountain was the Matterhorn, and it's in Sweden. So, again, fact-checking is your friend. Elon Trump team. Fact checking is your friend.
Yeah, although Mount Assiniboine looks remarkably like the Matterhorn.
Now is this
I guess I'm just looking to plug. I'm just looking to plug Mount Assiniboine. If you're looking for an amazing getaway, a fantastic place to hike. But yeah, not the point. Canada's the 51st state. What's the reasonable comment on that aside from it's just a really dumb idea? And
here's the thing. You think it's dumb, but the Trump team, Elon, Trump, they know what they're doing with social media and marketing. And to say something like that, it lets them get a window into what kind of base they have over here in Canada, because they're about to start doing deals with Justin and talking to Canadians about the border.
Justin.
And you know what I mean, Prime Minister.
Sure.
So these guys, although you may say it's dumb, it's stupid. I just said the photo was dumb. It's always just they're reading the meters. They're seeing what the temperature's like over here, because they're about to come up here in literally like a month and start talking about border.
Yeah. Duck Dad, I love that. What a great handle. Says if the healthcare model is broken, these are fighting words, says it's time to remove it as a provincial responsibility. They don't seem capable of delivering an adequate system. If I would have read that during the conversation with Minister LaGrange, the provincial minister, she would have found a way to point a finger at the feds. And if I would have pitched that to the federal minister, he probably would have treaded carefully, because there is that thing around provincial autonomy. It's a real thing since inception in Canada. This is just the way it works. The provinces, and it's not just the loudest provinces. It's not just Alberta and Saskatchewan that love their lawsuits and that stick up for their natural resources and that stick up for their jobs and what drives their economy. And you all know what I'm talking about, suing over the carbon tax and making a lot of noise. Like, obviously, I think, Alberta and Saskatchewan typically are the loudest on that front. Quebec makes a lot of noise as well. Doug Ford in Ontario is not afraid to make a lot of noise. But provinces, I mean, that autonomy is so important. And I just think, Duck Dad, I love the comment, but you just know that's just absolutely a non-starter, and there's no way that it's going in that direction. So the fact of the matter is, you got to find a way to find a solution. And that's one of the reasons why we want to get the different ministers on the show. We tried to coordinate both of them on at the same time, and we'll do something like that down the line. Schedule-wise,
we wanted the smoke.
I think it would be great. You want to have the smoke in the room.
We didn't have the fire today, though.
Speaking of smoke in the room, I didn't expect to talk to singer-songwriter Matt Masters for 15 minutes about smoking weed yesterday. Yeah. But if you missed that episode, that was a really interesting one. Matt acknowledged that he had a cannabis addiction and vowed to swear off smoking weed after 30 years. And we had a really, really good conversation. I want to note something like Lauren in our chat said something like, super chat contributions may lead to liver damage, because you and I joke around a lot about how the super chat, that funds our Real Talk beer fridge. And there is a certain element of truth to that, but not totally.
It may surprise you to find out that we have actually cut back on all our extracurricular.
Don't ruin our reputation.
No, but we have, because we know the New Year's coming. I know. I'll just put it out there. I don't want to embarrass you, but you've been going to the gym, and we've been getting healthier around here. But we do take those funds and make everything better for our guests in here in the green room and everything.
Yeah,
we enhance their experience,
actually,
which makes them want to come back.
I'm going to send you a photo in Slack. It's just sent right now to our DM channel.
Okay,
if you can find a way to put that up, and I'll prove to Real Talkers that are watching on YouTube or any of the visual mediums aside from the podcast. I'll describe it for our podcast listeners. Can you get this photo up as soon as you can? And
10 seconds.
We'll just look at how fast this guy works, you guys, and we'll prove to Lauren that liver damage is something we're actually trying to avoid. But I'll bring the thought around with Matt Masters. We do recognize on this show, and sometimes people use the word normalize. Look at this. There it is. Boy, this guy's the best in the West.
Bubblies and Red Bull and
look
and
at
pop.
this. Look at our Real Talk
water.
studio fridge right now. Yeah. This is row after row after row after row of alcohol-free options, because we want to make sure that people that come into this studio don't feel pressure to be surrounded by booze. And all of this is funded by our super chat. So thank you for those of you that have helped us stock the Real Talk fridge.
On the door, there is a few choice bottles of champagne and wine. But
the door does have 6 different kinds of martini olives and 5 different types of bourbon cherries. But still, some folks might use the word normalize. We just keep it real and talk about, our own personal convictions. But we do talk about alcohol on this show. We talk about cannabis on this show. We joke around about stuff from time to time. But it actually actually meant a lot to me, and I was thinking about it through the day. After we talked to Matt Masters about cannabis and about him invoking the word addiction, you don't hear people use the word addiction as much when it comes to cannabis. Heroin, sure. Fentanyl, absolutely. Like any opioid, right? Coke, whatever. Like, meth. People are addicted. They became addicted, and people go, yeah, I have an alcohol addiction. I have a sex addiction. I have a gambling addiction. Cannabis, people kind of, I don't know, have you noticed this? People kind of like seem to, maybe it's just me, people seem to kind of roll their eyes or smirk. Nobody really thinks that it's a real thing. And Matt really hit it head on, and he talked to us about the impact it was having on his family, his relationship with his kids. I thought it was a really excellent conversation. And as somebody who uses cannabis, you guys know I'm a cannabis entrepreneur. I'm in the business. I'm an investor in a private company, like yada, yada, yada. It gave me pause to think. And I really think that it's a healthy exercise for us to examine our relationships with the substances that help us relax or get more creative or help us get a little bit more social. So I encourage you to check that episode out. That was the 4th of December. John, before we go any further, I want to remind folks.
Jeez.
Well,
It's my mother or my partner when I'm in trouble calls me John.
I sometimes call you John, but
you do.
Johnny,
On the intro of the show, occasionally you'll be like, our intrepid producer, John Hicks. I'll be like, that sounds so...
Okay, I'm sorry.
I like it. It's professional.
Is it infamous? You're rolling with like
call me
six different handles. The budget process is underway, and most people, their eyes glaze over when they start talking about municipal budgets.
Mine do,
But the thousands and thousands of members, closer to 10,000 than you'd believe, of Civic Service Union 52, that's CSU 52, want to remind you that your opinion really matters. And if you are a taxpayer, a resident in the city of Edmonton, they want to know about your priorities. You can check out their website at edmontonforeveryone.ca. The city is going through budget deliberations right now. You've probably seen Tim Cartmel. He announced his mayoral run on this show. His Instagram is like ramping up. He's taking people behind the scenes of those budget deliberations. He's trying to create a little distance between himself and the incumbent. But the CSU 52 members, well, all they care about is that the city is budgeting for the things that matter. Edmonton rapidly growing. Over the next 10 years, the population set to continue to climb, and that means that despite the fact that affordability is still a reality for a lot of people in Edmonton, that's part of the reason why people are moving here, the city is at a critical crossroads, and the choices made today will shape the future for everybody. CSU 52 members are the ones that are answering your calls to 311, to 911, the ones that are picking up garbage, running rec centers, helping you check books out of the library. And they want to remind you that budget needs to reflect what matters to a community. CSU 52 is the heart and soul of Edmonton. Without them, the city, quite frankly, doesn't function. You can give them your feedback, show your support to their campaign by visiting their website, edmontonforeveryone.ca. And we are so proud to partner with Complete Care Restoration. We hired these guys with our own money, so we're putting our money where our mouth is. The team at Complete Care Restoration built this marvelous studio that we come at you from out of the historic Mercer Warehouse every single day. They were able to work with some of the, well, what do we call them? Unique challenges of a heritage building. They helped us fix a weird persistent water leak and everything else, and we've seen them at work. Their professionalism second to none. If you experience an interruption in your home or business based on natural disaster or otherwise, I mean, heck, it could be asbestos in your basement. You didn't realize it was there until you did. Now the wall's open and you got a real problem. Let the professionals handle it. They've got more than a quarter century of experience restoring properties, rebuilding peace of mind, and they'll work directly with your insurance company to take that off your plate. You can find them online at completecarerestoration.ca. So it was a pretty interesting story. The president of the United States, Joe Biden, to remind everybody, Joe Biden still is president until the 20th of January. Pardons his son, Hunter, which he had promised that he wouldn't do. It came on a Sunday, which is oftentimes not going to do it. A lot of announcements will happen on a Sunday or on a Friday afternoon, oftentimes, when a government hopes you won't notice something. Everybody knew that this would be noticed, but despite the fact that President Joe and Dr. Jill Biden had both said the president wouldn't pardon Hunter, He did. Now, we've received a lot of comments on this, and of course, I think a big part of this has to, some of you have written in and said, I think it might have had something to do with the outcome of the election. Well, yeah, for sure. And the fact that
I think I said that on
Donald
the show.
Trump is,
and you're like, duh.
I'm like, I mean, I think I should have said something like that was a good point, John. That's
Way
a very
to go,
good point, John. But we wanted to get to some of the comments. We asked for your feedback, and we want to get to it as well. So I posted on X, on Twitter. I just said Biden promised he wouldn't pardon his son Hunter. Then he did. What are your thoughts? Karen says Americans just elected a rapist and a felon. I'm not sure that anything matters anymore. Mark B., who watches us out of SLC, Salt Lake City, Utah, says the precedent was already set when Trump pardoned Charles Kushner for much worse crimes. Then he nominated him to be an ambassador. Republicans don't play nice anymore, so why should the Democrats? I mean, I guess. Chris says at least he waited to see the types of nominations in some key justice and law enforcement portfolios first, which confirmed the worst expectations. I think Chris is absolutely right. He says, or maybe he was just waiting for his Angola flight to depart, which is completely overshadowed by the pardon. Look at that. One story overshadowing another. Where have we seen that before? Larry tweets at me, says, benchmark on integrity and honesty has certainly gone out the window with the election results. He says we even see that here in our home province of Alberta. So really, as a society, we're kind of saying integrity doesn't matter anymore. It's more about entitlement. So really, what does Biden have to lose? Jungle Gene says Cash is on record. He'll destroy Hunter Biden. So I'm glad Biden's calculated his reputation with reality. What an interesting way to put it, Gene. Says he's chosen his son. Says these people are monsters. There's no bottom to that pit. Snake Juice says good on Biden. I mean, there's kind of a theme here, Johnny. Says Trump was selling these off at the end of his first run, the pardons he's talking about. Bannon, D'Souza, Flynn, Kushner. He set the precedent. Why should Democrats try and play by the rules that no longer exist? I don't love the premise of that last statement, but I get it. Addie says, big deal, enough already. Addie's heard enough. Just Me says, if your child was being threatened, Ryan, by a bunch of lunatics, wouldn't you? I replied to Just Me. I said, listen, I'd kill for my child, but I'm just some guy in Canada. It feels a little bit different when you're the president of the United States, but there was a recurring theme. Ken took us up in the email inbox. He said the Hunter Biden pardon is justified to remedy injustice perpetrated in the American justice system and legislative oversight process. The gun criminal charges for an addict, he's talking about Hunter, obviously, had only been laid once before, and he was acquitted. The persecution by the MAGA Congress resulted in nothing of substance against Hunter after years of abuses of political power. Presidential pardons, says Ken, are to right wrongs when the systems fail, and that is the case here. Mm-hmm. That from Ken.
Yeah, I agree. Some of those pardons by Trump were crazy.
Well, just wait.
144,
just wait.
So I mean, and if you go through the list, some of them were public, some of them kind of went under the radar, just like we were talking about. So I hated that when we talked about this on Monday, that, and I like those comments and I agree with some of them, but I hate when people come back with the argument, well, Trump did. Let's just talk about nepotism and Hunter Biden and Joe Biden and how, it wouldn't be as bad if he had not directly said, I am not going to do this, and then flipped. People are allowed to change their mind, but they're also, subject to the flack that they get afterwards. But if you want to bring up Trump, 144 pardons, but then someone could say, well, Obama in 8 years, over 1,700 pardons. I was looking them up. So it goes back and forth. Let's just say nepotism and the way Biden did this was not great.
There's kind of an interest in our Real Talk live chat powered by Park Power. Ms. KD says, changing your mind is not the same as a lie. I mean,
it's similar.
It's gray area. That's gray area. Doobie says Biden probably wasn't going to pardon his son until he saw that Russia won the election. Interesting way to put it. How about this? Donna B. Good morning, Donna, says Joe did the right thing, in my opinion. Says I'd have done the same thing with the things that Trump is threatening. Another one, the Dems need to stop taking butter knives to knife fights. Ken K says that, Trump pardoned more than 20 of his associates, just nominated another one for an appointment. So, I mean, I guess this is kind of like, people are, comparative behavior is an interesting thing. Mm-hmm. Like, we did this, but it's not as bad as this. Or we're doing this, but look what they did. But listen, I get this. I mean, somebody, White Dream says if you openly admit you would kill for your child without being facetious, you need therapy. I don't know.
about
I don't know,
that.
man. Bust
Jeez.
into my house and threaten my child and find out what fucking happens. Are you
Yeah.
kidding me?
What
Are you not a parent?
That's crazy.
Show me a parent that wouldn't kill for their. Are you fucking kidding me, dude?
I'm not even a parent, but I can see, like, Joe's protecting his son. He's near the end of his life. He's doing a last minute thing to make sure his son, who is also, you look at him. Wow, his stress has really gotten to him. He used to be like this good looking. Now he's like,
Are you
great.
talking about Hunter?
Oh yeah, it's like when you had Obama's first term and you looked at his 8th year term, the gray hair, losing the hair, like clearly stressed. He's had, like you talked about, financial issues, drug problems, all these things. But I mean, this is an elderly man protecting his son. If you want to get to the bare grits of it.
Why does it matter that he's elderly?
I know. Okay, stop doing that. You always pay
Well,
me.
no, that was it. No.
I just mean he's coming near the end of his life, and if your son was about to see the inside of a jail cell, there was a good chance, a more than 50% chance. I mean, he was investigated by Biden's own DOJ. I mean, I think anyone would do the same thing. They would protect their family.
Yeah, Donna B says, right, Ryan? I'm the same. Of course you are, Donna. Every single parent is. Alberta Girl says presidential power there to be used and abused. Name an outgoing president that would not have pardoned their own child. Max Chipman says, I would do whatever it takes to protect my child.
That's something I should look at, because I looked at how many Biden or Obama pardons there were, how many Biden ones there have been, how many Trump did, because he was only in there 4 years. But I should look more in depth at the numbers on how many happened at the very end of the term.
Well, most of them.
Yeah, of course. Right?
Yeah, most of them. There's you can read Politico. They have an interesting feature. You and I were taking a look at a couple of days ago. 4 presidential pardons from history that were way more controversial than
What's
Joe Biden's.
number
People can read it at
okay.
Politico.com,
All right.
and then they give us 50 cents for every time somebody clicks on
Ding, ding, ding.
No, that's not actually true. But there were some interesting ones as a historical matter. They get into it. George Washington, way back in like before 1800, right? George Washington and the Whiskey Rebellion, which was kind of a cool story you can look into. Andrew Johnson and the Reconstruction is another one you can look into. George Herbert Walker Bush Sr. and the Iran-Contra pardons were a big one. And then Bill Clinton on his final day in office, that was January 20th of 2001, issued a pardon to his half-brother. His half-brother, Roger Clinton Jr., who was convicted back in 1985, 16 years prior to that, of conspiring to distribute cocaine in Arkansas. But he was trying to. This is an interesting one because he was trying to rebuild his life, pursuing a career as a musician and an actor. But his criminal past was hampering his ability to rehabilitate himself, like it does for maybe not hundreds, millions of people around the world. I mean, you want to talk about like legalized cannabis and some of that judicial reform. There are so many people, most particularly Black Americans, but there are many, 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 many people whose minor and petty cannabis convictions over the years, like we're talking about small possession charges and the like, are hampering their abilities to pursue meaningful careers, to gain education, to benefit themselves, to better themselves.
Obama gave a lot of clemency to full 20 years. So Roger Clinton's brother's presidential pardon, his brother Bill, half-brother Bill, restored certain civil rights like voting, eliminated legal disabilities associated with a federal conviction, but was obviously very controversial at the time. So there's some interesting ones. That was a nepotism one too, that kind of, back then you didn't have social media, so it wasn't as, but I do remember it happened because, I don't know, maybe it's because there was cocaine involved and some other things. But hey, Obama, going back to him again, 0 family members pardoned by that president. So.
Yeah, really amazing. But the most drone strikes in history. People up to
See,
that
there's
point.
always, it's just, yeah.
Well, let me say, I always sort of, there's nothing funny about war, but people always say like Obama, oh yeah, the peace-loving hope. He was responsible for the most drone strikes in presidential history. Yeah, because drones didn't exist before.
Exactly.
Obviously.
I often talk about that with people when they say that. I say, do you know how much of that was testing? Because it was like literally some of the first times we were using it at that frequency, at that rate. And now presidents that use it have more accuracy. They have more data to look at to know how to minimize civilian casualty, all of that. There had to be a president who was going to go through the shitstorm of it first. And it just happened to be Barack.
How about this from Vamp Fashion? Says, my grandfather was a lawyer and a judge, and I grew up knowing I was responsible for the consequences of my actions and no favors would be coming. Yeah, I think if your grandfather is a judge, grandmother's a judge, you're almost.
I'll put you in the hole.
Well, you're almost going to be more responsible. Like you'd be held to a higher standard, I think. Yeah, I mean, Ms. KD says there's teenagers sitting in prison 10 years for weed possession. It's the new slavery. Heck, maybe that's something that we'll open up on a show to come. That's obviously an issue. But John, it does feel like the right time. I'm hosting a private event on the 6th, which means that this will be our final episode of the week. We're back live again Monday or later on demand. But as we wrap every week, our friends at the DQs of Northwest Edmonton and Sherwood Park give you the opportunity to put your hottest takes in front of thousands of people. It's the Flamethrower, presented by the DQs of Northwest Edmonton and Sherwood Park. And John, this is an all AI edition of the Flamethrower. Every once in a while, we take a submission and we decide to put it in the spotlight. And I love this. You and I were talking about how ChatGPT is transforming business.
Sure.
It's transforming industry. It's transforming education. It's transforming efficiencies. And I love this from Bernard. Bernard, getting creative, says, Jespo, I'm just having some fun. After listening to you and Johnny go off on ChatGPT, it got me thinking about how it might write a flamethrower. He says, so here's what I gave to ChatGPT. He says, please note, Ryan Jesperson from the podcast Real Talk has the Flamethrower segment every Friday. Please write a flamethrower on the reasons why we should limit ourselves with ChatGPT. And here's what it came up with. So this is ChatGPT's flamethrower, courtesy of Bernard. Stop overfeeding the machine is the title. Let's cut the fluff and get real. ChatGPT is like that one friend who's always ready to help you with your homework, but can't actually take the test for you. It's a tool, not a crutch. The second we start outsourcing our brains to the AI overlord, keep in mind it's the AI overlord that's writing this, we're signing up for intellectual atrophy. You want to flex creativity, problem solving, or critical thinking? Then stop asking ChatGPT to write your emails, solve your dilemmas, and maybe even pick what you're going to eat for lunch. The problem isn't the technology. It's us, the humans. AI, see, this is how they get us going. AI can spit out the answers faster than a microwave heats leftovers, but the ease of it all makes us lazy. I mean, why read the book when you can just ask ChatGPT for the summary? Why dig deeper into a problem when you could just plug it into the bot? We're risking turning into a society that knows how to ask questions, but not how to think. And thinking, that's humanity's superpower. Not Googling with flair. So let's talk creativity. ChatGPT is impressive, but it's derivative. It pulls from what's already out there. You want groundbreaking ideas? You won't get them from a machine trained on yesterday's data. Over-reliance on artificial intelligence stifles the spark of originality, the thing that makes our art and our writing and our solutions human. The flame of creativity burns brighter when it's nurtured by struggle and discovery, not handed to you on a digital platter. This is actually pretty good. It goes on to say, and don't even get me started on relationships. ChatGPT is going to teach us about relationships?
I hope not.
Sure, ChatGPT can draft the perfect apology text or charm your clients, but at what cost? Authenticity gets lost when your voice is coming from a program. Your friends, family, and colleagues want you, not some algorithm's best guess at what you should say. Look, I'm not here to torch the whole concept of AI, says ChatGPT. It's useful, powerful, and game-changing, but let's stop pretending it's harmless when we overuse it. Like any tool, it's only as good as the person wielding it. Use it to assist, not replace. Lean on it for support, not a shortcut. Because the second we let AI take the wheel, we're not just limiting ourselves, we're losing what makes us uniquely, gloriously human.
Okay.
So go ahead, use ChatGPT. Just don't forget to use your brain too. That from Bernard by way of ChatGPT.
Thanks, Bernard. I often forget to use my brain, so I'll put that into my Apple Watch and my iPhone and my MacBook and my ChatGPT to remind me. Also, Netflix, Subservience, Megan Fox, if you want to see what a real AI relationship is like.
There, he's giving you something to watch over the next couple of days. Hey, if you have a friend or a family member that you know would benefit from the types of conversations that we have on this show, make sure you tell them where they can find Real Talk. Make sure you subscribe to us on YouTube and wherever you get your podcasts. And thank you for being part of the show. We truly appreciate you, Real Talkers. The Flamethrower is presented by the DQs in Nemeo, Palisades, Westmount, Baseline Road. I mean, these are the DQs, the family-owned locations that deserve your business. When you swing on by, make sure you let them know that Real Talk sent you. We're back again on Monday. Until then, Keep it between the lines.
Real Talk is hosted by Ryan Jesperson, executive producer Josh Dunford, technical producer John Hicks, general manager Katie Cook-Chivers, account coordinator Lawrence Derlego, human resources Lena Shepard, website design Mike Johnston, voiceover by me, Carrie Skelton. Real Talk's editorial board is Supriya Dwivedi, Ahmed Ali, Brandy Morin, Ann Castleman, Corey Hogan, Harmon Candola, Catherine O'Neill, and Chris Henderson. Member Emerita, Julie Rohr. Real Talk is recorded in Edmonton, Alberta on Treaty 6 territory, the traditional and ancestral territory of the Cree, Dene, Blackfoot, Saulteaux, and Nakota Sioux, home to the Métis settlements and the Métis Nation of Alberta. Real Talk is a relay project. For more, check out ryanjesperson.com.